these things. So albumin, globulins, acute phase proteins, immunoglobulins, fibrinogen. How are they measured and recorded? Well, total protein and albumin are measured via a chemical reaction. Globulin is calculated by total protein minus albumin, right? Because remember, globulins was all the other proteins. And then the albumin globulin ratio is calculated by dividing albumin by globulin. You can also, so sending out chemistry profiles can be expensive, so you can also measure protein by using a refractometer. On some CBCs, there's differences, like there's the total protein for a refractometer. Like if you were to measure it on a refractometer, I think is what that means. And it's only an estimate, I think. Okay. There's also serum protein electrophoresis. It's only used in like labs. You're never really going to work or use that in practice. It's very, very intensive. Separates proteins into different fractions, like albumin, alpha globulin, beta globulin, and gamma globulin. Globulin, goodness. Part 4 of this review is the interpretation of each test. How to interpret. Dehydration can cause an increase in serum concentration. Hey Todd Littrell, how are you? An increased production or a reduced loss in clearance can cause serum concentration increases as well. A decreased production, an increased loss or clearance, or overhydration can decrease serum concentration. Increased albumin is hyperalbuminemia. Dehydration is pretty much the only significant cause of this. Very, very easy, very specific. You know, if you've got increased albumin, it's usually and most often specific for dehydration, meaning your patient is most definitely dehydrated. Unfortunately, not all of these are that easy. Hypoalbuminemia can be due to liver failure, starvation, inflammation, or marked hyperglobulinemia. So there can be many causes of this. But again, talking about mild to marked, there's going to be differences, and if you've got a mild difference versus a marked difference, that's how you can tell this is more suggestive that it's this disease versus it's more suggestive that it's that disease. Liver failure, for example, you can have any amount of albumin, hypoalbuminemia, any amount, and you can say, well, it could be liver failure. Part 2 of decreased albumin, hypoalbuminemia, plasma loss due to or with hemorrhage, GI loss, renal loss, or high protein exudate. Could even happen due to overhydration. Am I a doctor? No, not yet. I'm in vet school though. I'm in my second semester of my first year. So I will be a doctor in about 3.5 more years. I'll be a veterinarian. Increased globulin, hyperglobulinemia. Due to increased production, could be because of acute inflammation, chronic inflammation, or lymphoid neoplasia. Doesn't happen due to decreased loss, and usually very, very mild loss if it's due to dehydration. Decreased globulin, hypoglobulinemia. If it's due to decreased production, it's usually a result of failure of passive transfer. For example, foals or calves don't get the colostrum that they need in order to have those antibodies in their first stages of life. And if they don't get those, they grow up without them, and they can become very sick. There's ways to correct it, of course, but that's the general problem. If it's due to increased loss, it's usually a result of plasma loss, GI loss, or loss in exudates, similar to albumin. And it's not lost with glomerular disease. So remember, the glomerulus is part of the kidney. It helps with filtering your blood. And the reason it's not lost with glomerular disease is because globulins are much larger than albumin. They don't leak through those filters, those glomeruli. Goodness. If it's due to overhydration, it's rarely below the reference interval. So it's uncommon. Hey Fernando, how are you doing today? If you've got low proteins, just look if multiple statistics are decreased, not just one. That will help narrow down what you're looking for. Now on to increased fibrinogen. There's hyperfibrinogenemia. If it's due to increased production, it's usually a result of acute inflammation. Or it says here APP. I'm not exactly sure what that means, but that's one of the results. If it's due to decreased loss, well, it says right here that just doesn't happen really. But if it's due to dehydration, again, very, very mild. Very mild changes. If you're dehydrated, yes, your proteins are going to change. You're going to have an increased amount of proteins in your blood because you've got less water in your blood to dilute those proteins. I'm going to take a quick drink of water here. Next is decreased fibrinogen. Hypofibrinogenemia. Cannot be detected using a refractometer because it's not sensitive enough. It's hard to tell low from normal. There's the possible causes of this. Not really decreased production. It's not seen clinically. Can happen due to increased loss via one example is disseminated intravascular coagulation. Not a good thing. That's where your blood literally just starts coagulating while it's inside of you. I think that's scary. And hydration doesn't really affect this one. Interpreting everything is the most important part of clinical pathology. That's okay, Todd. No worries. Didn't affect much on my end. You don't want to just jump. Oh, I was looking at sorry, I clicked the wrong button thing. I didn't know if you were talking to me or something. So if you've got a stat that's raised or lowered, you don't want to just say, oh, this dog's got cancer, or oh, this dog's got liver failure. No, there can be multiple reasons for a stat being raised or lowered. For example, low albumin in a dog. That can be due to many things. It can be due to liver disease, cachexia, I don't know if that's how you say that, renal loss, or GI loss. And there's more, of course. Could be due to overhydration. Again, we talked a little bit about that. If you've got polyuria, polydipsia in a cat, that can be due to many things. Diabetes mellitus, that's the sugar diabetes. Renal disease, or hyperthyroidism, and there's more. You can't just say, oh, this animal's got a raised or a lowered albumin, they're in liver failure. No, that's not how it works. So the magnitude of the change is usually pretty important, because again, there's mild changes, there's marked changes, which are great changes. Usually the marked changes have fewer things that can cause them. What happens when a dog don't move? Well, then the dog sits still, I guess. When it doesn't move much. Well, are you referring to like an older dog? Could just be that the dog's tired, trying to sleep. Yeah. As dogs get older and older. Oh, new dog. I don't know. There can be many reasons for that. If it's, is your dog eating, drinking, pooping, peeing, and breathing? If so, then I wouldn't worry about it. But if it's causing you to worry, I would recommend taking it into a veterinarian, because there might be something wrong with it. I don't know. I'm not a veterinarian yet, so I don't really know how to help you much there, but could be due to diet, maybe. Is your dog getting a little heavier, possibly, or anything like that? Okay, so that was all for clinical pathology, pretty much. There's again, and I've said this already a couple times, she is a pit bull. Okay. Yeah. If you were to talk to any veterinarian, they'd probably say I'd need to be able to see it before I could help you out in any significant amount. There's so many things that could be causing the issues you're describing. So I don't know. But I've said this multiple times. So mild changes in a marker can have multiple causes. Dehydration, overhydration. But marked changes, large changes, significant changes, right? Those have much fewer causes. You know, there's not many things that cause markedly decreased albumin, except liver failure, right? But mildly decreased albumin can be due to starvation, hyperglobulinemia. You know, there's multiple things. Anyway, okay, this is it for January 15th stuff. Or the January 15th material that I learned. Next, I'm going to end this stream and I'm going to start another one in a couple minutes. And we'll start off with GenPath, general pathology. So, thank you all for watching. See you in the next one.